Joining us on the show is a renowned clinical radiation oncologist and a research program director of the NSIA Youth Cancer Center, Dr. DJO Joseph. She's also the founder of Doctors Cancer Foundation. Welcome to the show, madam.
Good morning. Thanks for having me.
Good to have you. So we discuss cancer every year, and it's always a good opportunity to remind people on prevention. But can cancer really be prevented?
Some cancers can be prevented. Cervical cancer is one cancer that can be almost exclusively prevented through vaccination, through screening. Colorectal cancer, colon cancer, can also be prevented if you do a colonoscopy and they find a polyp. I don't want to go into too much medical terms, but some cancers can be prevented. Some cannot. They can only be detected early before they become advanced and often incurable.
You said there is a vaccine for cervical cancer.
Yes.
This is the first time hearing of it, or maybe I've heard it.
No, you've heard about it.
Old age has made me forget. So please remind me.
You've heard about it, the HPV vaccine. So you might just not connect it to cervical cancer every time we think about it. And particularly because we're doing it in younger populations for now. But HPV vaccine prevents cervical cancer, prevents most cervical cancer, and with vaccination you can almost exclusively prevent it. Another thing with cervical cancer is that screening detects it before it becomes cancer and can also remove the abnormality, can remove the abnormal parts before it becomes an actual cancer. So cervical cancer can be eradicated. There's a potential for it to be eradicated.
Wow. I have an uncle that recently passed on, and it was really sad because he was healthy, perfect, living a happy life, fit, those stuff, and he just went for a medical checkup, and then he said he had liver cancer. But he said Jack Robinson, within a month or two, he was gone. How does that happen? Somebody who's not in his 70s, or somebody probably early 60s or late 50s, how does that happen?
Well, so the first thing is, I'm probably the best person to tell you that cancer doesn't necessarily correlate with age. As you know, I work with a foundation for pediatric cancer, that's cancer in children. So the age is not really, I mean, yes, you expect it in older people, but again, it depends on the type of cancer we're discussing. The thing that is there, though, is that idea that someone was perfectly healthy and then, you know, it's progressed very rapidly. What happens is many times, and with many things that are not even with non-communicable disease like heart failure, heart disease, stroke, and co, it happens that it seems like the person is in perfect health, and then all of a sudden he has stroke. Is always sudden. It's always sudden. A heart attack is always sudden, but it's not really sudden though, because it's been building up until the point where you then have that so-called sudden effect, and that's why it's good to have a health check once a year, especially when you are over 40. There are certain things that you must do. You should have a mammogram every year. As a woman, you should have a pap smear every year.
Every year? I thought it was every 2 years or 3 years.
Well, so it depends on what the findings are, to be honest. But if you start at 40 and you've had your mammogram at 40 and you've had a pap smear, it depends on what the results are and what tests you do. So, for example, with cervical cancer, there are different combinations. If you do HPV DNA testing, you don't have to repeat it in another year or two. So I think you can even wait up to 5 years. So it depends on the level of testing you do, and it depends on what the results are. Sometimes, based on the results, you want to do something called an interval follow-up, where they want you to have it done again in 6 months because there's some questionable findings, but there's no definitive diagnosis of a malignant tumor. But the point here is that you should have a consultation and have a general health check. I think that's the important point.
So when we talk about cancer, it's always been the case of God forbid, God forbid, God forbid, because like it's one of those things that it seemed like the Yoruba people call it arun jejere, like something that will just be eating, it eats people up, eats up funds, eats up life, and many people keep thinking, how can I, like on a prevention journey? It's a journey of let me eat, let me drink agbo, let me do all these things. What would you say is the most worrisome approach for you as a professional in terms of how to deal with diagnosis of cancer? What do you hear in your journey that makes you feel like, I need to put this out there for people not to do it?
I think the most important thing would be nutrition. So I was saying to someone recently, 86% of people ask me about nutrition by their second appointment of patients, ask me about nutrition. And what you find is many times they've been given very, very misleading information. So you find people who are on juice fasts, who are drinking only water for 2 days and eating on the 3rd day only, who are on very, very restrictive diets that will not help and will only harm. And I try to explain to people this way: if you drink only water for the next 1 month and you don't take treatment, the cancer will continue to grow. You cannot starve it. It will take what it needs. It is the rest of your body that will starve and make you even weaker and more unable to fight the disease. So I think the one common myth that worries me the most will be nutrition. There's a lot of bad advice that goes around. It's good to be healthy. In fact, it's very important. Everybody is trying to get healthier, including myself. So it's important to be healthy, but it's like somebody has malaria, and then you say the treatment is to drink juice only for 1 week. That's not going to treat the malaria. It's not.
You won't.
Okay. Right.
When it comes to, the topic of cancer, there's this concern. Like, gosh, I hope as I'm talking about it, it's not in my vicinity. And in your being a practitioner in this space, would you say that Nigerian women are aware and educated about this? Would you say you're seeing more Nigerian women becoming more aware about cancer and all the treatments or investigations that they need to do? Or do you think that Nigerian women we need to reach more Nigerian women about cancer?
I think it's 3 things. I think the first thing is everyone in general in the whole world is afraid of cancer, and they should be, as it should be. I always say, if you're not afraid, you're not paying attention. It is scary. It is a difficult disease to have to treat. It will eat up finances. In any part of the world, it's very expensive to treat. And in particular with our population where there's very low insurance coverage, and it is devastating. The financial toll of cancer is devastating on any family. So it is scary. I think people are more aware in general of health. Generally, everybody's trying to live a healthier life. And I think it's a bit of a contradiction in that we're trying to get healthier, even though our lifestyle is generally more unhealthy. Our parents walked more, exercised more, ate healthier. We tend to eat more unhealthy. We eat out more. We cook less. We exercise. We're coming from our car into our office, so we're less active than their generations. However, we're more health aware than they are. They didn't do those things out of a health consciousness. It was just their lifestyle. We are more health lifestyle aware than their generation would, but our lifestyle is unhealthier. So it's a bit of a contradiction when you think about it. But in terms of cancer specifically, there's definitely increased awareness now. I wouldn't say that we have reached even 70% coverage, because most of the data that you're getting is from urban centers. You cannot pull Lagos and Abuja and think that you have a good picture of Nigeria. You don't. The greater population of people are not included in that urban pool. So I do think we need a lot more coverage than we have.
Let's talk about after diagnosis, because we talk a lot of prevention, how can you do not to get cancer, but now a lot of people are diagnosed with cancer, and their fear is, do we have the right equipment in Nigeria to treat it? Can I get proper treatment in Nigeria? Where do I go? Do I look for a cancer center, or can I just go for I can't afford a cancer center, I'd like to go to a regular doctor. What are the options available in Nigeria?
First of all, I want to thank you for that question. That's just an excellent question, because we talk a lot about prevention, but the truth about it is that people are going to be diagnosed. And I tell people that there are 3 million breast cancer survivors in the world. So cancer can be survived. It can be treated. It's expensive, it's difficult, but it can be treated and it can be. And we really need to begin to talk about that. As much as we talk about detection, prevention, there will be people who will be diagnosed, and we don't know who. Now we talk about 1 out of every 10 men. 1 out of every 10 women will have cancer in her lifetime. So at some point we need to think about, if it happens, what do I do? And I'm just really grateful for that question. Now, to answer the question in terms of what we have, the progress that Nigeria has made in the last 3 to 5 years, let me say, is astounding. I can tell you, Sydney, if I was just reading messages now about a new center that was commissioned in another state in Nigeria. In the center where I work, the NSI Youth Cancer Center, we have 3 linear accelerators. We have curative treatment for cervical cancer. We have brachytherapy for cervical cancer. We have chemo suites. We're affiliated with the hospital where we have surgeons and everything. And we have survivors. We it's early to present our survival data because you want to wait 10 years, 5 years before you start talking about it. But we're successfully eradicating cancer every single day. I tell my friends, when I'm playing with my friends, I say, you know how they say, you're too serious, are you curing cancer? Yes, I am, absolutely. Absolutely. So we do have treatment available. The progress that we've made in the last half decade has been wonderful.
Wow, fantastic.
Yes.
I just want to, because there are people like me who are always afraid when you get all this, it's not my portion.
Oh, suddenly
No.
it's not your portion.
Mariah's uncle, for instance, he was okay. As according to Mariah's story, he was okay. He just said, let him go for checkup. As he just went for the checkup, they just diagnosed cancer. From the minute he diagnosed cancer, within 1 month, if he hadn't gone, would he still have been here?
So here is the thing, though. If unfortunately he's not here for us to ask him, but you will find that if you probed a little deeper, there was something wrong, and that's why he went for that checkup. He felt some kind of ill, and that's why he wanted to go and check. Number one. Number two is that the truth is, even if he didn't, eventually the symptoms will show up. Eventually, and what will happen is he was perfectly fine, and then in just 1 week, we were hearing something else.
That's not true. I went for checkup last year, and I wasn't feeling ill.
Well, yes, but most people don't. Most people don't do it until they feel something is wrong. Many times, most people. I don't know this person's specific story, but this is what I can say. Even if you don't do a checkup, the symptoms will eventually show up. The checkup didn't cause the cancer. It was there, and it was going to show up one way or the other. However, what I can say is there's so many angles to this. Is what was the psychological care that he received after? What was the cancer care that he did? So part of the question I didn't speak to is that cancer has to be treated in a cancer center. It has to be treated by specialists. Unfortunately, I am a medical doctor. I went to medical school. I know how to deliver a baby, but it would not be right for me to try to do that. Because if it became complicated in any kind of way, I would be as lost as the woman who is having the baby. That's the truth. Because if you are not doing something every single day, spending your life and your time studying it and learning it and being immersed in it, you simply cannot be the best person to handle it.
Let me give you an experience of my mom. And her and somebody else. So my mom had cancer, which she knew about, pancreatic cancer. And there was somebody else I heard that had the same cancer that she had. So his doctor was in Germany. So he went to Germany. He was feeling, he went for holidays. He was feeling somehow sick. He just went to go and check his doctor in Germany. And based on what they found, they told him, bro, go home, put your house in order. God, you don't have more than 3 months. And when he came back home, all he did was prepare. Put his will in order, planned his burial, did every funeral, put a committee for his funeral. He planned his entire funeral because he had 3 months based on his doctor. It was clear. And that 3 weeks or so to it, he started to deteriorate and he knew he was going. My mom, on the other hand, the doctors kept saying 6 to 8, 1 year, 18 months. And I'm thinking, oh, I'm hopeful. I'm thinking, okay, there's something that, I'm feeling like there's long term. Nobody told me I got 3 months. Nobody told me like, listen, no, this is it, and we're hopeful. Is it that we don't have enough equipment to know the degree of what we're dealing with, or it's cancer? So what that was the difference? Because I felt that hits me a bit. I feel like I wish somebody told me, you got just 2 months, 3 months, then we can put certain things in order.
So here is the thing. I'm one of the most aggressive advocates for letting people know what the prognosis is. And I have senior colleagues. There's a bit of a generational gap in this prognosis matter, in discussing these things. And so let me tell you one of my earliest experiences is I had a patient who had lung cancer. And she was poor. There's something when we say, look, she has started dying. The process of dying has started. And her sons were doctors. So I called them and said, listen, you need to come and be by your mom's bedside. I'm not even sure she's going to make it till morning. This is it. We're at the end. We've given it our best shot. Unfortunately, we're at the end now and it's time to say goodbye. So come and sit by mom. Come and give her hugs. Shower her with love. She's going. And she needed platelet transfusion. And her sister was saying she wants to transfuse. And I was telling her, look, there's no point doing this. Let her go in peace. We're just tormenting her at this point. And her sister insisted and said, no, I'm going to transfuse this woman. Anyway, to cut this long story short, she went on to live 2 years after that.
Wow.
After I told her she's dying tonight. Yes, she went on to live 2 years. And I can't even begin to tell you how many people like that have said, listen, I give it 6 months. And then 6 years later, they're still coming to the clinic.
Testimony based on your story.
Don't you hear those stories in the hospital? The doctors
said,
gave me 3 months, and here I am now. So you have to get to that point. You have to get to that point where you find an honest balance. You say, this is what the data says, but I cannot give you a timeline. I don't. The truth is that, again, a lot of the data that we're referencing is Caucasian data. It's not data in our population. So you find many times that what the data says does not correlate with what you find clinically. And so I have had to learn the hard lesson of respecting my seniors when they tell me, stop telling people they have 3 months and 6 months. You don't know how much time they have. I have also told somebody, listen, this is not going to kill you. We're going to manage it. And he's dead in a week.
Jesus.
I've also said that. Because you don't have all-knowing power to know how. You can treat 2 people the exact same way, with the same diagnosis, with the same medication, and they respond very differently.
The other one's juju is...
It's not about... So, you know, we watch all
Cancer
this,
biology is very interesting.
I've watched a few of all people that have recovered, survived from cancer, now set up a YouTube channel and talk about their experiences and all of that. And I've watched a particular guy's story, and he was talking about the power of your beliefs. So I'm a belief person. I believe that our beliefs make us and we make our
So
belief.
am I.
So how some people just think, because if you feel like it is over and then sort of you're not able to will your body into making the drugs work or whatever process you're going through. So these people on YouTube feel that we're going through all the treatment, but we strongly believe that we are going to survive, and the strength of our faith, and somebody else that did not believe it did not work. So what's the place of having therapy, mental health support while on this journey? What do you feel like Nigerian medical system is giving mental health support to people who are going through cancer?
So again, this is an excellent question. And if you remember when we were talking about her uncle, I said, what sort of psychological care did he receive after? And I am a strong believer in belief and faith. And I tell people that, listen, whatever it is you believe in, if you don't believe in a higher power, believe in yourself and your ability to go through treatment successfully, it makes a huge difference. And sometimes that difference cannot be documented and measured in numbers, you know, but you can tell anecdotally that this makes a difference. The difference between someone who feels defeated and who is unsupported and who is alone, and the difference and someone who is optimistic and who has a great support system and who believes very much in something or the other, is always very clear. And it is clear even in how they respond to treatment. So it has a huge place. In my center, again, for example, the Youth Cancer Center, the NSI Youth Cancer Center, we have a psycho-oncology program that supports everyone, you know, and you have the opportunity to speak with a counselor and even to receive medication if you need it, if you need medication. And I do think our system has not always been as conscious of this as it should be. But again, you have to look at all the factors. It's not entirely the system's fault.
Right.
When you're struggling to pay even the cost of care, the cost of the actual treatment,
psychologist.
Spending money on mental health care can seem like we don't yet have money for this. It's just as you go along, you begin to realize how important it is, and it is part of the treatment.
Let me take this call from Alari Waju. Good morning, Alari Waju. Are you there? From the UK.
Good morning,
You're live.
and the ladies. Come, yeah.
Morning.
You know, my contribution to this. Hello.
Well, you're live. Go ahead, please.
Okay. My contribution to this is that in UK here as well, doctor can tell you that you have maybe 3 days, even a week to live, and people live even maybe 5 years later before they die. The point people forget is that God is the creator. He has the power in his hand. And he's showing us that we as a human being, we can speak. It's him that we put.
Alari Waju, oh, I lost that call. I'm so sorry. Yes, Miriam had a question.
Yes, I just want to go back to nutrition again. And a lot of people talk about the place of sugar in the cause and also maybe the treatment of cancer. how impactful is sugar in our diet to the spread of cancer and maybe the effect of treatment on cancer, or it doesn't play any role at all?
Okay, so the first thing I'm going to say is we have to, first of all, clarify that we're talking about refined sugar.
Yes.
So there's sugar in a lot of things. There's sugar in yam, in rice, but that's not the sugar we're talking about. We're talking about refined, unhealthy sugar here. Now, it has a place in disease because it makes you overweight, it impacts your immunity and all of that. And so sugar does cause disease, okay? Refined sugar combined with an unhealthy lifestyle in an excessive amount causes disease. When cancer is established, there are 3 ways to eradicate it that I can speak of. Radiotherapy, surgery, and chemotherapy. And chemotherapy is everything, hormonal immunotherapy and all of that. At that point, I explain to people that at this point, you actually even need calories to be able to fight the tumor, to be able to go through treatment successfully. This is not the time to go on a restrictive diet, which is what unfortunately tends to happen. At this point in time, if you, like I said, if you drink only water for the next 1 year, it has no impact on the tumor. The tumor will grow. It will feed itself. It has everything that is in your body it needs. It will take it. It has nothing to do with what you put into your body at this point anymore. That's not to say that somebody who is on treatment, like any normal person, not to say that anyone who is not, I shouldn't have said normal, but anyone who is, you know, behaving the way they should not be taking excessive amounts of sugar. Right. So, I mean, what I usually ask patients when they say, what can I eat or what should I not eat? I say to them, okay, so don't drink battery acid and don't drink insecticide. You know, we start laughing. And I say to them, what do you eat? You eat rice and stew, eba and efo. The normal things that's fine. If you don't spend all your time taking pizza and fried chicken and unhealthy food, fast food, you will be fine. Right. You can have it even once in a while, as long as it's not too much. Right. Instead, let's talk about tobacco, let's talk about alcohol, and those things that you do need to really cut down and try to eliminate at this point in time.
Okay, there's a question I wanted to ask you, because I know when people have cancer and they're dealing with these kind of issues, they get advice from all over. Take soursop, don't eat any more carbs, only take vegetables, you know, and don't do chemotherapy. That chemotherapy is a death trap. Don't try chemo, just go and be eating, they'll give you these vitamin supplements, so use this one every day in the morning. And people come in sort of telemarketing and tell you, this one cure this cancer, that one cure this cancer. Don't believe all the medicines they've given to us. Could you give us some clarity? Because sometimes it gets a bit convoluted when you have so much information, and as a patient, you're wondering, what do I do?
Again, it's very simple. There are people who say, my grandmother, for example, had this herbal concoction for malaria at that time. And she believed very strongly in it, that if you have malaria and you drink this, you'll be fine. When my mom and I have conversations, the first thing I say to her is, did you do a malaria test to diagnose the malaria before you even know if, you know? So it's possible that there are remedies out there that may work. Unfortunately, they have not been properly trialed and tested. For you to be, the whole point of treatment is, I need to be sure that I can replicate this thing in whoever else comes along. If it works for A and it doesn't work for B and it doesn't work for C, D, and E, then it possibly works for F. That's not a treatment that you can replicate, and it's not something that you should prescribe. So that it worked randomly somewhere is not, for me, enough evidence, and for the medical community, enough evidence for you to prescribe it. For you to prescribe it, you need to be able to predict that when I give it in this dose, I expect this response. And that is what chemotherapy is. And again, like I said, there are millions of cancer survivors in the world that have gone through these treatments. Nobody's going to pretend that chemotherapy is easy or pleasant, but it works when you do it right. If it is done wrong in the hands of somebody who is not qualified to use it, then it can really become fatal. It can become dangerous. That's what I would say about that.
Okay,
yeah, because you killed my sister, but that's not what I have a friend whose husband was diagnosed with cancer, and so they changed his diet. And this is like 10, 15 years now. The cancer is still manageable. At that stage, small stage. It's not growing and it's not reducing, but he's following this strict diet.
What type of cancer did he have?
I think it's prostate.
So you know that one of the, because I could have told you that it was prostate cancer. Because when you diagnose prostate cancer now, there are different treatment options. And depending on, we do something called risk stratification. If it is a low-risk tumor, we do what we call active surveillance. You don't do anything, you just observe the person. Because when we talk about prostate cancer, we talk about men who are going to die with prostate cancer rather than from prostate cancer. Because there are some forms of prostate cancer that are so indolent that nothing is going to happen for the rest of his lifetime. You don't actually need to intervene. There are some that you need to intervene, and we have that more commonly in black men, unfortunately. Black men and African American men tend to have more aggressive forms of cancer, and they develop it younger. That's prostate cancer. However, there are some forms of prostate cancer that are indolent. And I see patients with prostate cancer in the clinic, and I tell them, we're going to just monitor you for now. We don't need to do any aggressive intervention at this time. And they remain stable like that for years without any treatment. So that is the first thing. I don't know that the diet, it always helps to get healthier. So if you change your diet to a diet that is healthy, there's nothing wrong with that. The problem is many times the diet they change to is unhealthy. You cut out nutrition groups that you need. You become so calorie deficient that you then develop other problems. That is the problem.
I have to wrap up, but I have to ask you this personal question that came to mind. How do you manage seeing somebody today, they're dead tomorrow, in and out daily, and you are still back to work, and you're treating the next person, and you know this person might die in one day, you know? And you're a doctor, and you're a mother, you're a wife, and I'm thinking, so how do you manage that emotion? How do you manage to even live for the next day? You're talking to us.
Yeah, here talking to me. I'm thinking of how I'm going to manage you visiting us.
You are talking all this English now. We are living here, probably going to the hospital, going to see another patient, God forbid, you know? So I'm thinking, how do you put it all together?
So I will be honest. I will be honest and reveal that it does have a significant toll. It does take a toll, especially when, well, maybe not for everyone, but for me, because I work with children a lot. So there are days when you go to your house and you just fall down on the floor and you're, you know, in a mess. Other days you get up, you pick yourself up, and you just have to keep going. One of the things that happens is at some point it becomes a job. So you sort of become a little bit immune. The problem with that is that you have to remember your humanity. If you become too immune, you lose your empathy.
Right.
So you have to keep pulling yourself back to, you know, remain in that place where you remember that the person sitting in front of you is somebody's whole world. Is, you know, something happens to them and there's a whole family out there that's going to be devastated. And you have to try to remind yourself of that with 30 different people that you're seeing on a daily basis. So that balance where you're able to detach from it when you finish and go home and still be okay with your family and okay with yourself, you know, while remembering all of that is what can be a little bit difficult to find.
All right, I have
But
to
you
go.
find it.
We have to
Well
go.
done.
Well
What you do
done.
with your
Well done.
foundation as
Thank
well.
you.
Hope you're not jackpotting anytime soon.
You better not.
Well, not yet.
Yes, that's a big word.
Is that not yet?
Okay.
Put that here.
That's
Just know
all
that
we
they are
can
important
take.
place.
We've been speaking with Dr.
all
Adedayo Joseph. She is a renowned clinical radiation oncologist and research program director at the NSIA Luth Cancer Center and the founder of Doctors Cancer Foundation. Thank you so much.